Hi, Mike Gibson, Dennis Kim, and Rena Silver joining you here live from SCAI 2015, talking about Seconds Count, SCAI's program to increase awareness of the importance of achieving early and timely reperfusion. Well, I remember when I was young, a couple decades ago, Chris Cannon and I wrote the paper on Time is Muscle, really the 27,000 patients worth of NERMI data showing that for about every hour we delay, there's a 1% increase in mortality. And we've done a great job, I think, as interventional cardiologists over 20 years, improving the door to balloon times by almost an hour. And that has really resulted in an enormous reduction in mortality. That's the good news. The sad news is whittling away another 15 minutes isn't really going to change much. The mortality didn't change. So we still have 2.5 hours before people get to the hospital, or even 3 hours. So that's why I think Seconds Count is so important. So what is it? I mean, tell us a little bit about the effort and the website.
Yeah, those are great observations. I think that, certainly where we make the biggest impact is educating people and families to understand when these events are happening, what the warning signs are, how important time really is, how every second counts. When we started the Seconds Count initiative many years ago, it's probably about 6 years now, the intention is to create a family-centered portal for people to get cardiovascular information, both in terms of how it might affect their treatments, certainly about awareness, and things like this. And so, we wanted to create something where we could give families from children who have congenital heart disease or even in fetal life all the way up to older patients and family members who might be sustaining a myocardial infarction some tools to use in their education. We certainly know that the educated patient achieves better outcomes. And there are a lot of various sites on the web that one can go to seek this kind of information out. We want to be a comprehensive site to accomplish these educational missions. And we also want to give families tools that they could use in order to help manage their care, both for prevention as well as when the time comes to actively seek medical attention.
Now, Rena, you've been actively putting together some of the content. Tell us about the quality of the content on the site.
Sure. It's a high-quality website. The content is managed by physicians, nurse practitioners, nurses on the editorial board. Dr. Kim and I are on the editorial board, and it's nice to have control of what we want to put out there as far as interesting content, late-breaking information, what's new in interventional procedures that are available to patients, and good high-quality content.
I think that's something that makes our website unique, is that all of the content and information is either authored or thoroughly vetted by people out in the field taking care of patients. So nurses, other healthcare professionals, physicians. So we know that the information that we have is accurate and timely and represents the best of what's out there.
Now, one of the ways to influence patient behavior are, patient narratives about what happened with them. So tell me a little bit about some of those dialogues that you have on the site.
Sure. So the site was redesigned actually within the last year or so. It has a beautiful format, and it's focusing on these patient vignettes that will highlight a patient story, which educates people about symptoms and treatment, and also provides some hope as far as a nice public interest piece.
We have 3 that we'll be showing here at this conference. 2 have already been put on the website. A 3rd one will be unveiled during this meeting. And I think that what is really great about it is it shows sort of the whole spectrum. Initially, the first story with Tony is about a firefighter who had a MI. His coworkers realized that it was important, and it shows his story. The second actually shows how technology, the technology that we have, can be used to really help people. And so Curtis's story is also on the website as well. And the third story we have in the pipeline right now involves Ian, who's a young boy with hypoplastic left heart syndrome, and the challenges he faced very early in life, and how the team approach in the cath lab really saved his life and got him to where he is today. So, I think that these patient stories and vignettes are very powerful. I think that we hope that that's a portal where the public will see these vignettes and then try to delve into the content that we have to educate themselves.
Yeah, to change behavior, information, data is necessary, but it's really not sufficient. You really have to connect emotionally with the person that you're trying to change, and I think that's why these vignettes are so powerful and impactful.
I mean, surely, yeah. As practicing healthcare workers, I mean, just looking through all of the stuff in medical literature can be overwhelming, and
Sure.
And so really being able to first connect on that personal level, and then try to drive education from that is probably the most straightforward way and most effective way of doing that.
So you guys are now on Facebook. Any other things going to be happening in the future?
Oh, certainly social media is a big part of everybody's lifestyle these days. Maybe perhaps less so for some of us, and we're a little older, but we're learning. We're not old dogs quite yet. But certainly I think that with Seconds Count, we want to be active in that social media stream, and so we're active on Facebook and Twitter as well.
Yes.
Right.
And hopefully there'll be some good stuff coming out on those avenues during this meeting.
Great. Well, it's really a curvy linear relationship. Our ability to improve things is steepest at the very beginning of these symptoms, and that's why the seconds really do count. Well, congratulations, great effort, and thanks for joining us today here at SCAI. And thanks to all of you for joining us live from SCAI 2015.